Hi, I'm Dr. Ashley Herrin, and I'm a doctor of Oriental medicine and an acupuncture physician, and I also do medical Qigong. And I'd like to just thank Charles and Sandra for inviting me here today to share with you a little bit of information about Oriental medicine and other modalities that I do. And I also wanted to mention that I'm a licensed practitioner with the Centers for Spiritual Living, and I've been trained to do affirmative prayer for those individuals. And my private practice is in Fort Lauderdale, and I've been in practice many years, and it's such a passion and a joy to do what I do. So just so I know my audience, how many of you have had acupuncture? Okay, that's a good number. It's really, someone was telling me on my drive over that Dr. Oz is starting to mention acupuncture a lot, so that's a good thing, because I oftentimes get, I hear quotes from him. So, but what I'm going to do is I'm going to start out just giving you a little bit of a history of Oriental medicine as I know it. I've been trained both with the traditional Chinese medicine, and also I did a postgraduate training with a Japanese style that I'd like to share. It's a little bit unknown in this country. There's only 100 of us in this country that perform this style. It's called Toyohari, and that means meridian therapy. And this style came to be from blind. In Japan, if you're blind, you can be an acupuncturist or a massage therapist. So a group of acupuncturists in Japan about 500 years ago started this style called Toyohari, meridian therapy, and the reason they did this is because they learned different ways of doing acupuncture because they were blind and they couldn't really insert the needles in the body. But what they learned from being blind is that they became very skilled at stroking the meridians and feeling the alive point. And it wasn't necessarily the anatomical point where we had been trained in traditional Chinese medicine. It's, you know, this far from this muscle or this bone or something. But they would stroke the meridians and they would feel the point. Then they learned if they brought in a silver or gold needle into that area and didn't quite penetrate the skin, but rather held the needle above the skin and just got very centered and very still in their presence, quieted their mind, knowing that, you know, if their mind was still, there would be a much deeper channel. And so they learned that becoming this presence and using the silver needle, holding it just above the skin, almost like the etheric body or the aura, they learned that it was a much more powerful treatment because the energy above the physical body is much faster and much stronger. So I've been trained in this style, and also we use the pulse as a way to go back and check and see if the points we just did work, because we know the pulse should be at a certain level. So this style is very unique. There's only, as I said, 100 of us in the country. I'm the only one in Broward County that does this style, and it's very gentle because we don't insert it into the physical body. So it's very good for needle-sensitive people or kids or things of that nature. So my training has been in both the Chinese style and this Japanese style that I do in my practice. And as I said, the Japanese style, the etheric body, is a very powerful experience. It's just a connection. We really connect to the universe that way really well. So, but this medicine was started around 3,800 years ago in China, and I believe, and people often ask me, well, how do they know where these meridians were? There's 14 meridians and 371 points, and I just believe that it was just intuition, that they lived in nature, they lived with the animals, they lived with all the plants, and they just intuitively knew where these energetic lines existed. And so thousands of years of testing them and playing around with them, they just documented them and kept documenting them in books and oral lectures, you know, for many thousands of years. And Chinese medicine today is the oldest continuously practiced medical system in the world. And today it's used, still today, by 60% of the world. I often say to my patients, if this is almost 4,000 years old and is used today by 60% of the world, then it works. Otherwise it would have died out a long time ago. So, and it does work. It works so well for so many people. And I want to give you an idea of how this medicine started. It's known as the emperor's medicine. And the reason that is these thousands of years ago, there were emperors in rule. And some of them had up to, this is very well documented, some of them had up to 100 concubines. And I know, can you imagine? And they had to, and they wanted to appear ferocious and strong and have a big family so that they would appear powerful. And they also wanted to impregnate these women. I mean, this was way before Viagra. Yeah. So they had to have a lot of stamina, a lot of energy, and of course the fertility was important. So what they did is they would, of course, bring out the best doctors in China to be their personal doctors. And they basically said to them, you know, we want to be strong and we want to live long. The Taoists who were the, you know, that philosophy back in China, they were obsessed with longevity. They really wanted to live long. They knew it was possible to live longer than they were. So they sort of demanded that these Chinese doctors get the herbs, you know, get the acupuncture and really help these emperors be strong and to live long and to impregnate all these women. And it's very well documented that these thousands of years ago, the average lifespan in Asia and China was 60, and the rest of the world it was around 30. And so it just really speaks to how this healthcare system can help us to live longer and to be stronger and so many more things. So that's basically the history of it in a brief synopsis. And I lived in Japan in my 20s many years ago, and one of the things that really impressed me, because I lived in Okinawa and I lived in Tokyo and many other parts of Asia, and what really impressed me being American was how agile and strong and young the older generations were. And it struck me really, really strongly how the difference between our culture and the older generations versus in Japan. And it was one of the things that inspired me to come back and study this medicine more, because that was my passion, was to help people to do the things and learn the things that would make them live really well in the last few decades of their lives. So it really is a wonderful way to stay young and healthy, etc. So of course the question is, why do we want to use Oriental medicine, other than I just told you, you live longer and you have more energy. But of course, I'm sure all of you do know that this is it's very safe, it's very natural. We don't do any surgeries or use pharmaceuticals. The herbal medicine that we use is from plants, some animals, mostly plants. We do try to do the organic, processed, organically grown ones. And there's no adverse side effects. So when you take our herbs or you do the acupuncture, there's no adverse side effects. Also, another reason is we address the root cause. And this is where I really spend a lot of time with my patients. I know that illness doesn't happen in a vacuum, or disease. There's always a cause, it's usually a belief system, or believing in statistics or things like that. So I always want to understand, why did this manifest for the individual? And being trained in metaphysics, I'm always asking about, you know, do you believe that because of your genetics that you're going to get this, or that at your age people start to get these things, or in statistics, you know, statistically 1 in every 3 people will get whatever. And so I spend a lot of time with my patients on their belief system, or have they been given a diagnosis or a prognosis from a doctor, and that belief system's so ingrained that there's no room for a new idea or a new thought process. So Oriental medicine, and the way I practice it, I'm always addressing the root cause, and not just treating the symptoms as oftentimes some healthcare systems do. And this is also a holistic medicine. We're treating the body, mind, and spirit as one, knowing that our emotions play a big part in our body. And doing medical Qigong, I'm able to work, and what that is, it's a modality that I've been trained in, again, from China, where there's universities and hospitals in Shanghai and Beijing that just use Qigong as a method of treatment. And now that training's been done here in the United States, and basically what we do is we purge these emotions out of the body. We just, again, the etheric body, not the physical body, but let's say the liver usually holds our anger and resentment and frustration, and that's a big one today in our society, and it causes a lot of problems in the body, like it could cause, female reproduction issues, or it can affect the gallbladder or the heart or many organs. So what we do is we purge these emotions out of the body. We just, kind of grab it at the etheric body and toss it, purge it out. And then we bring in color and sounds to give that organ back its natural state of being. The Chinese know, and Qigong is our oldest modality. It's even older than acupuncture. And what they discovered is that with our organ systems, certain colors, for example, the liver, green. If something's up with your liver and you close your eyes and you envision green, coming through your body into the liver, it's a healing for it. And there are sounds for each organ system that, sounds are vibrations, and every organ system has a different vibration. We can use sounds also to heal certain organs. So I use the sounds and the colors in my practice with medical Qigong to heal the body as well. And again, that's working at the etheric body. There's a video, maybe, I don't know if any of you know Greg Braden, but he's a spiritual teacher, and he talks about this video of in one of the hospitals in Shanghai. They call it a medicineless hospital, but it's really a medical Qigong hospital. And there's a woman there who has a cancerous tumor in her abdomen. And there are 3 medical Qigong practitioners in the room with her. And what they're doing is they're just having a different idea about this woman, seeing her as whole, complete, and perfect. And they're using this ancient system of Qigong to heal her body. They have a sonogram on this tumor, and as these practitioners are using their bodies to send their energy into this woman, you see this tumor disappears within 3 minutes. And this is something that is very much going on in these hospitals in China, and this is what I know. I've seen it happen, not so much those tumors disappearing, but I've seen bodies getting better very quickly with this medicine. So these are just the different modalities that our healthcare system encompasses. It's really quite fascinating. So, also, Oriental medicine is very preventative. We've been trained to see illnesses or diseases before they happen by the pulse. We can tell when an organ system has some stagnant energy in it, or we can see the color of the skin gives us clues, or the tongue. The tongue is an organ that we can see different aspects of it that we can see, well, this organ system's weak, and so this medicine's very preventative, and actually, and this is also very well documented, that in ancient China, the doctors used to only get paid when the patients were well. So imagine that, you're paying your doctor today. Imagine this, all right? So imagine we pay our doctors $100 a month or whatever to keep us healthy. You know they would be, and then they only got paid when we were well. You know that they would be working to prevent illnesses. So this medicine was really the root of it. Another root of its inception was to be preventative, and it is. I can't stress enough how much we can see things coming. We can see strokes coming by the tongue. If you stick out your tongue and your tongue is slightly slanted, it could be, not always, but it could be a sign of an impending stroke. There's just so many signs that we've been trained to, signs and symptoms that we've been trained to hear and to see and to sometimes even smell. We can smell certain organ systems, like with diabetes, the kidneys. Sometimes there's like this smell that we've been trained to notice in the body when there may be, some blood sugar issues coming. And there's an old Chinese proverb that speaks to this, and it says, it's better to build a well before you're thirsty. And that's so true. I mean, we really, it's much easier to prevent disease than it is to cure it. So a lot of my patients come to see me on a wellness program where they pay by the month and they can come in as often as they want. And this is just to keep them well, to prevent things in our modern stressful society. A lot of people need that. So it's a good idea just to consider using our healthcare system just to stay healthy, to stay well. It's like, tuning up your car before it gets run down and then you have to go have it fixed. It's much easier just to take it in for some tune-ups. So, Oriental medicine also is very diverse in many things that it treats. It treats about 80 to 90% of all things. Some of the common ones that we're known for are addictions. I have a lot of patients who come to me smoking, alcohol. I have a patient now who's young, he's trying to get off heroin. Of course, anxiety and stress is probably the second most common thing that I treat outside of pain. And I wrote an article on my website. I did a lot of research on how stress affects our body, and the research is showing that 80% of all illnesses are related or can be traced back to stress, because these stress hormones from the adrenals, they weaken our other systems, the hormones and the every aspect of our organ systems can get weakened by too much stress. So anxiety and stress help a lot of patients get off of their psychotropic drugs like Lexapro and Prozac and so forth. Arthritis, very good for that, and asthma. Treat a lot of colds and flus, very good for the immune system, HIV, cancer treatments, helps really well for that. And many of you may know we do a lot with infertility. I often say I've gotten many women pregnant, so it really does. There's a research showing there's about 40 to 60% greater chance of getting pregnant with Oriental medicine. Menopause, that's a big one. A lot of hot flashes out there. Those signs out there. Your wife is hot. I always think of that. I always think of that for me. Bring her in, and she's having hot flashes. It's an air conditioning billboards, I guess, right? Insomnia, a lot of that out there too, especially with the stress keeping us up at night late. And pediatrics is one of my specialties. I love introducing this healthcare system to children because they will have an experience of it as they're young, and when they get older, they can make a choice for alternative medicine, and they really enjoy it. They really enjoy it because we don't insert needles in them, by the way. We use these tools to, their energy is very fast and they get well very quickly. We just have to stroke a few meridians and do a little tapping here on a few points, and 5 minutes they're pretty much done. It's very, very fast for them, and they enjoy it, and they get better really very quickly. And so it just introduces them. And I know, you know, one of my passions is to have our younger generations using this medicine as their healthcare system. So I love treating kids and introducing them to that. Weight loss, that's a good one. A lot of people come to us for weight loss, and we can build up, rev up the immune system, metabolism a little bit. But again, you know, we have to look at lifestyle. It's not a quick fix, but it really does help with metabolism. And facial rejuvenations, have some women coming to me, and actually men too, looking for alternatives to Botox, and the acupuncture is very, very effective in this area. So, yeah, it really, I mean, it really works. It works well, and it's safe, no surgeries, and much better than plastic surgery or Botox. So to recap, it's a complete healthcare system. There's a few things that, you know, we don't get much success with, but typically anything we can help with symptoms, signs and symptoms, making them feel a little bit better. And it also supports our body's own healing system. I mean, we have this incredible healing system within our body, and if we quiet our minds and become present, and we can heal our bodies. And this, when you're under this acupuncture, when you're lying on that table with a few needles in you, you go into this, for those of you who've had it, I'm sure you can relate, you go into this different state. Some people call it the delta state. It's kind of like between being awake and being asleep. And this is the healing state for us. You know, we can do it anywhere, anytime, if we just quiet our minds and feel the presence and feel our energy. We can heal our bodies. We need to do it regularly, you know, and many times throughout the day. But when your energy has been balanced with these meridians, with these needles, you're in a healing state, and you know, miracles can happen. I've seen them just very quickly. Things just turn around, and people get well very quickly. And when we can stay in this state, and I often get asked, of course, do the needles hurt? And I wish I had another name for us, like pillows or something. I mean, they're really needles. They are, but they're nothing like the hypodermic needles that we know when we get injections or shots. They're very fine. They're about the width of a hair, and they're flexible. That's why they really don't hurt. And as I mentioned, the Japanese style that I learned is totally painless because there's no insertion of the needles, and so it's really quite pleasant experience. I wanted to share with you. I like to do an interactive talk, and I wanted to just share with you 2 acupuncture points that you can do on yourself for stress, because we all, sure, at one point in our lives we have a little bit of stress. A little bit more than a little? Okay. So I'm just going to show you a couple points on your wrist. They're kind of close to each other, and we use them very commonly for stress and anxiety. So the first one is on the heart meridian. Our heart, you know, is our largest energetic center, and I believe that's how we connect to the matrix of the universe and all. And these meridians, I know, is what connects us to each other and to the matrix, you know, of our energy systems. So this first one is one of our most important meridians on the heart meridian. Our heart can, of course, settle us down a little bit. So both of them are on the inside of the wrist. I'm just going to turn here a second, and if you pull your hand down, you'll see that there's a crease. There's maybe more than one crease, but it's the top crease. And if you follow your pinky down, just follow your pinky down to the first top crease. It's right there. And you don't have to be too precise. You can just press there. It might feel a little bit tender for those of you stressed. And what you do is you just press in and make a little circle. So just press in a little bit and just do a circle. You can do clockwise and then turn and do counterclockwise. Does everybody find that?
Did you say it's on the first crease?
On the first crease. When you bend your wrist, you'll see more than one crease. Most people do, but it's the top one. Yes.
Which hand?
Both hands. Just follow the pinky down to that crease. And when you get to that crease, just start pressing and then do a little circle.
Does it matter the direction of the circle?
No, you can go clockwise and then go back counterclockwise. Just do it for a few seconds. And it'll treat your heart meridian, releasing some tension, a little bit of stress. And you can do this at any time. The one contraindication, caution, is for women who are pregnant. You might want to be a little cautious for both of these. Okay, so that's and it really works very well. The second one, how does it feel?
When you do that, what are you supposed to do?
Well, sometimes it might be a little bit tender, or you may feel nothing, but it's still working. It's still working. It does feel good, right? Yeah, and you do it just for a couple minutes, and you'll notice that your energy sort of settles down a little bit.
Is it a good idea to do both sides?
Yes, I would recommend doing both sides. And I have some handouts too. I'll give you later. You can take home to show them. Okay, so that's the first one. The second one is close to that one. Again, finding that top crease, but this time you follow your middle finger down, and you'll feel, and just press the top crease, sort of in the center of the wrist, if you will, as opposed to the pinky side. And again, press in, do a circle, clockwise and counterclockwise. And this is on the pericardium meridian. Many of you may know that's what encompasses our heart. So both of these are related to the heart, and our stress and anxiety will quiet down when we do these. And do both sides. So those are two very important points that we use on any patient that has anxiety or stress, which is most everybody.
Is there one behind your ear?
Behind the ear?
Over here?
Do I use the ear?
Yeah.
Yes, I do, but that's kind of hard to show in a setting like this. But yes, we use the ear a lot for stress, anxiety, yes. It's very good. We put the seeds in them sometimes for that.
The first point below the pinky, is it just contiguous to the bone?
It is. There are tendons there and bones. Yes. Yeah, you got it. Yeah. It's a big. I mean, you can. It doesn't have to be too precise. Just in that area, it would work because you're still along the meridian. That's what matters.
It's really in the center.
In the center. The first one is the pinky side. The second one is the center of the wrist. Both of them on the top, the first crease. Here. So, very powerful points.
Does it make any difference with your normal pulse rate for that to work? They say you have a slower pulse rate rather than the average person.
The question is, does it matter what the pulse rate is? And it doesn't. It doesn't. Either way, it'll work. It'll work regardless of your pulse rate or anything else. Yeah. So, I'm often, this medicine's also used a lot for animals, and they have no concept of whether or not this medicine works, and yet it works for them. So it's there's no placebo. It works regardless of your belief system or culture or anything else. So that was the basis of my talk. Are there any other questions that I can answer? Yes.
You mentioned that you can utilize several modalities.
Yeah.
How do you determine which one you use?
It's a very good question. Well, I always use my training, my acupuncture, the Japanese style, because that treats our root system. The meridians, when they're all balanced, the body's in a state where it can heal itself. So I always use that one. When I use medical Qigong is when I need a little more help in terms of treating emotions that I know are the cause. Like, for example, I had a patient recently. She was in the Gulf War, and she was exhibiting a lot of anger for the past 20 years, I guess it's been, 15, 20. And I treated her with acupuncture, and she came in angry, and I said, well, after the treatment, I said, how do you feel now? And she said, well, I feel better, but I said, you still feel a little angry? And she said, yes. So then I added the medical Qigong. I I purged her liver and just kept working there because I knew that was, here energetically is where we store our anger. So I just kept working at that and working at that and working at that, clearing it. And I could feel it when I ran my hand over her liver. It was just a lot of stagnation. So after I cleared it, then I used, I brought in divine green light to heal the liver. And when I finished that, probably took me 20 minutes more. I said, how do you feel now? And she said, much better. So I always start with acupuncture, but then I'll add Qigong or herbal medicine when necessary. But acupuncture can heal in and of itself. Sometimes we need more.
I have a question. Many years ago, actually, it's 30 years, my husband took Acupuncture
Yes.
for a knee problem.
Yes.
And he went to Washington. There was a man from, I think it was either China or Japan, I'm not sure which. At that time, they weren't allowing many acupuncturists, but it never did help him. Is there?
How many treatments did he receive?
Well, he was in Washington. I'm not quite sure. He just had one treatment or
Right.
two.
That's my thinking. It works, but it takes time. It's not a quick fix.
Okay.
Typically, pain takes minimum 4 treatments, but sometimes, depending on how long you had it, it could be 3 to 5 months of treatments.
Oh, he didn't have that long.
Yeah. Most of the time when acupuncture doesn't work, it's typically because the person did not get enough treatments. And that's our goal. That's our, yeah, that's our, one of the areas where we need to explain how the medicine works to our Western culture is that it's not a quick fix like with a pharmaceutical drug or a surgery. It takes time. It's like nature. It takes time to grow the beautiful oak tree, and it takes time for us to manifest things in nature. Same thing with our bodies. They're nature. I mean, we're one with nature. These physical bodies are one with nature. I see it when I travel to the desert. I see my tongue's a different shape, and you know, every part of our body, it shifts with different climates. So we, just like with nature, the acupuncture treatments take time to heal our bodies. So I'm sure that's what it was.
Now, it heals many different diseases, I gather from what you said.
Yes.
What about people that have kidney diseases?
Well, okay, that's a great question. These meridians run through every organ system. So when someone comes to see us for kidney disease, we focus on treating the kidney meridian or channel that runs through the kidneys. When we do that, the body has been given the energy has been lifted in that meridian, risen, so that the body can now heal itself. Acupuncture needles, there's nothing magical about them. We don't have medicine in them. But what they do is they tell these meridians, or they increase the energy of these meridians. They build it up so that the meridians run in through these organ systems. Now the body can heal itself because it's been given the signal. So that's what I would do. I have a patient now who has kidney disease, and that's all I do for her.
Well, there's several reasons for kidney disease. Okay?
Right.
And that's why I asked that particular question, because
Right.
there's so many different reasons why a kidney can be diseased.
Yes.
So you say you have a patient now. What type of kidney disease does he have?
Well, she has kidney disease because she's also diabetic.
Okay.
So yes, there's always a cause, usually a cause, but we would address that as well. Like for her, I help her with her blood sugar, the pancreas. So we don't, you're right, we don't just treat the kidneys, we address the different causes as well. So in her case, I treat the pancreas. Yeah.
If a person has multiple illnesses, do you treat each one at a different time, or you treat them all
The
together?
question is, if someone has multiple illnesses, do I treat them at once or all together? This medicine, we can treat many things at one time. You come in for a session, you can treat 12 things or more. So you don't have to come back each time for a different problem, illness. We treat them all. And oftentimes, a lot of them are related to us with a pattern. For example, you know, in nature, everything in nature, you've heard of yin and yang, I'm sure. It's kind of like our bodies also shouldn't be too hot or too cold or too dry or too wet. And when it is, we manifest symptoms. So let's say someone comes in and I know they've got too much heat in their body, and usually that's from diet, a poor diet, or too much stress, and we get excess heat. Excess heat in the body, so now what we call a yang excess or yin deficient, meaning the cooling, nourishing part of our body has been diminished, and the warming, moving energy is in excess. So they may come in and they're having insomnia because there's too much of this heat in their body, and they may get a skin rash. They may have hot flashes. They may have like night sweats, or let's see what else, heat, canker sores. There's many different symptoms that could be from just this one pattern. So when we lower the heat in the body, then many of those symptoms just get better, like all of them at once.
And conversely, if it's too cold.
And if we're too cold, we may have excess weight on us. We may have abdominal pain when we eat. Cold hands and feet all the time. And, you know, we're just overly cold. We may, our digestive system is the one that gets the most affected because we lose our digestive fire if we're too cold. So typically, I'm looking at bowel diarrhea is another very common one if our bodies are too cold. And in America, we're usually too hot. So from the stress, let's see. I think you were first, sorry.
How is the success of treatment verified? Is it objective? Is there a scientific basis for it? For example, disappearance of pain.
Yes.
That would be objective.
Yes.
But is much of it spiritual and change of attitude?
Definitely. And even things like making life decisions. I had a patient recently who was in a relationship, well, had out of the relationship, but had many ties with this person still for like a year and a half. They had not changed their name out of the phone system. I can't remember what it was. But as he was lying there, when he was dying, he was like, oh, I get it now. He had this awareness that he wasn't moving on with his life because he was still attached to his ex-partner. And so it's not just, people have all kinds of different awarenesses, how to make their lives better, how to be healthier, and not just physically, but in relationships or in their financial worlds. And so it just centers us to sort of be more just aware of our lives and what we can do. Well,
just to follow up, I didn't mean psychologically,
okay.
you know, mentally healthier, but I'm talking about any physical illnesses, you know, that someone would come and present to you.
Right.
I guess insomnia is sort of, you know, a little, that would be vague, you know, that couldn't be verified unless they had 20 successful nights of sleep following 20 sleepless nights. Yeah.
Well, let's take insomnia as an example. The way I quantify whether or not there's success is, are they not only sleeping a little bit longer during the evening, but the quality of their sleep? Do they wake up more rested or less dreams waking them up? And in most every case there's a way of assessing whether or not it's working, whether it's just whether the symptom is decreasing or they just feel overall better in that area.
So it's more than just there you're healed.
Right.
Okay.
Yes. Okay, yes.
Yeah, I have had several bouts of sciatica.
Mm-hmm.
And not the last time, the time before I went to a chiropractor,
Yes.
and he tells me that it was a pinched nerve.
Yes.
And he put me on some sort of a rubber, was vented shot water up against that rubber sheet. And then he did something with electrical pads.
Okay.
but it went away, but it didn't go away immediately. The last time, it went away on its own,
Okay.
which I look on the computer and said that it will. Now I'm wondering, would acupuncture, would it unpinch the nerve, or would I feel okay with the nerve pinched anyway, or?
That's, sciatica is the top 2 or 3 things that we treat. And the way it works, the sciatic nerve starts at the lower back and it comes down and it makes a sharp right-hand turn here at the buttock and then it goes behind the leg. Usually there's a muscle here that's pinching, it's called the piriformis muscle that's pinching the nerve. So the needles, when we do them in that area and other distal areas, we don't always do them right there, will relax that muscle and it will stop pinching the nerve. Or it could be a herniated disc that's pinching the nerve up in the lumbar, and we can soften the herniation of the disc, of the nerve, so that the pain is relieved from that. And our treatments are usually permanent, unless the cause isn't addressed. Most of the time, sciatica is oftentimes from sitting too long at a desk or in a. Had a lady who drove down from New York and didn't really get out of the car very much, and she got here and she had major sciatica. She didn't get out and stretch a little bit. So oftentimes I see it with people having desk jobs. So we need to address that. So I teach them how to stretch. Yes?
This is a little away from that. I'm fascinated by the Chinese medicine versus American medicine, and you hear these stories, one being totally physical and chemical, and the other being homeopathic, and so on and so forth. Could you just describe how it takes place in a typical, say, Chinese hospital? Because clearly, if they need to remove an organ, they have to remove it by surgery. But on the other hand, there may be some other kind of method used to take care of the tumor, for example.
Yes.
At what point are the decisions made in a typical Chinese setting?
Well, my understanding is there is, in many hospitals in China, there is a triage that you go to, just like here. But they decide whether this patient needs Western medicine. I'm not sure how they get to that decision, but I do know there are triages that decide between the Western medicine or acupuncture or herbal medicine, and the medical Qigong hospitals are not within the regular hospitals, they're totally separate. So, but they have both now in their hospitals. They have the Western medicine and they have, I guess, just like I know when a patient comes to see me, if they're out of my scope, and let's say their appendix is about to erupt, I'm not going to treat them, I'm going to refer them out to an emergency room. So I'm sure the triage in China know that as well. You know, can acupuncture help them, or do they need surgery? Does that answer your question? Okay. Yes, Dr.
You work with the hot needles where they have a little bundle of herbs and set it alight.
The moxa.
Or the electrified needles, I guess the Western version of that.
Yes, I use both when necessary. The electric stimulation, we call it, on the needles, I mostly use for stroke patients or people with paralysis, because that stimulation tends to awaken the nerves a little bit more than just if the style that I do. So, and the moxa, I don't do the style on top of the needle. I do what's called direct moxa. I just put the moxa right on the skin and burn it. It doesn't burn the skin because we pull it off right before it gets off. But this is modality David's referring to is called moxibustion, and it's an ancient modality of Chinese medicine where we use an herb called mugwort, and we place it on the body either directly or on the acupuncture needles, and it has a very healing property, and we use it for certain conditions, mostly cold conditions because it's a really warming modality. So, yes.
Before you said it also works on animals?
Yes. It's been for hundreds of years, even in this country, it's been being used on horses. And today, a lot of veterinarians are using it on dogs and cats.
Where would you get them in?
I can give you a couple of veterinarians that I know.
one other.
Yes.
I'm on the brain.
Say that again?
Brain damage.
Brain damage? How does acupuncture work? It can certainly, the way that for any neurological issue, the needles stimulate the reproduction of the neurons. So it can send signals to the body to repair the neurons. It works really well for most neurological issues.
I'd like to talk to Victoria there.
Sure, absolutely. Yes.
How about magnets? That,
Magnets?
that increase the energy?
Magnets, yes. I use copper and zinc pellets because they have a great polarity, and we use them on the meridians to stimulate a little bit more flow. Magnets are good too, but I use copper and zinc because they have a strong polarity. It's very good if you use them. Very good. Yes. Yes.
Totally out there.
Different subject? Okay. Or just
same subject,
okay.
but different concept. I'm a firm believer in acupuncture and Western, Asian healing. It's menopause, it's gotten me through a whole lot of different events.
Wonderful.
My question is, why is the Western Medical Society so reluctant to encourage and introduce this into physician training and the medical insurance and the healthcare system when it is, as you said, and as we all know, over 4,000 years old and proven to be effective and worthwhile?
Yes. Yes, I believe that we all have to do this from like a grassroots way because there's so much money in the pharmaceutical industry, and unfortunately that's what seems to be a big driving force. But I tell my patients that when they learn and they've experienced it, to call your insurance companies, and if they don't have coverage, and ask for it. I mean, the more millions of us out there asking our insurance companies to carry acupuncture, this is what we want. We want alternative health care with our insurance. They will start to listen. In terms of the MDs getting this training, I'm not sure how that, they're starting to invite us into their practices a little bit, very little, but a little bit. They see the value in it, and so we're integrating a little, not much yet, but I think the more that we speak to it and the more that the media has coverage around it, that it works, and the more people that are coming to us for help, they're going to have to change. They're going to have to shift to a more alternative approach.
I was introduced to Asian healing and acupuncture through an osteopathic physician, a family doctor. Apparently they're more inclined to be less prone to drugs and pharmaceuticals and more inclined towards a wellness healing mind-body thing.
Yes, osteopaths tend to be more leaning in the holistic approach.
They also go to school longer, correct?
I think they do, yes.
Yes.
Osteopaths, yes. Any
Did
other
you bring
questions?
business cards?
Of course.
That's what I want.
What you asking?
Yes. Yes, Jim.
You said you work on the etheric body.
Yes.
So then you do believe in natural healing and absent healing also.
Yes. Yes. Yes, we're all connected. We can heal at any level. Yes. I'm sorry. Let me grab him and I'll be right back. Yes.
Yeah, I guess there's been talk that DNA is changing the liver. Have you noticed any differences in the younger people in terms of their bodies, their receptivity, their sensitivity?
That's a very good question. I have, and I think to me, it seems they seem less dense their physical bodies. The kids that I treat seem energetically just more opaque and lighter, less. I think our younger generations are coming in with a lot less heavy energies, and as I said before, they get better so quickly. It's astonishing. I mean, just a couple minutes, and their pulse is just perfect. I mean, their bodies just heal so quickly. So yes, good question though, and I'm sure the DNA is absolutely changing for us, absolutely. So yeah, thank you for bringing that up. I'd like to be more aware of that. Okay. Yes.
Well, I was just going to answer a little bit to the lady in the back from some basic knowledge. At one time, Chinese medicine was not allowed in the United States, particularly. Now there are actually schools here. I know there's one in Albuquerque, and there's several others because it's becoming more and more acceptable. And it's becoming more acceptable by the AMA. At Emory University Medical Hospital in Atlanta, Georgia, there is a whole separate division of acupuncture. And obviously, if it wasn't accepted, they would not have that in their clinic. So it is becoming a mainstream type of procedure at this point.
Right. So yes, it is, and I encourage you all to request it of your politicians, and we're trying to get Medicare to cover us, which would be a huge feat for us as an industry, because then all the insurance companies would have to pick us up. We as a profession, we're very small in this country, but we got enough money up to hire a lobbyist to be in Washington, but as of yet, there's no bill before Congress. But we're hoping for that, and any kind of help that you can give us would be wonderful in terms of talking to your insurance companies, talking to your politicians, and we can do this. We can change this for ourselves and for our children and our generations to come, so that we do reach out for this medicine first, and we work with nature and our bodies to heal itself, and we are healthier. We feel better. Our minds are clearer. But we use Western medicine when we need it. I mean, I don't consider myself alternative. I consider myself complementary. Because Western medicine, we don't want it to go away. But we want to use holistic approaches when possible. And so I recommend us just getting out there and speaking about it. Yes?
You mentioned, I think, science of the mind and holistic medicine. The little I know about it, and also my granddaughter was cured by a holistic medicine person. But in looking into it, I found a confusion of different kinds of people. You've got psychiatrists, psychologists, you've got the Ernest Holmes Science of the Mind, and advanced degrees for that. And you've got a lot of shingles hanging up. Whereas with accounting, it's a CPA, or with financial planning, it's a CFP, or legal, whatever. Is there any kind of consolidation going on in the industry itself so that the public can sort of recognize this? Because I think that probably is the problem in having a uniform presentation to Congress or whatever, because you've got a lot of different kinds of degrees out there.
Yes.
And there are certainly enough people who are saying this is terrific and I've been healed, and as my granddaughter was. But the question becomes what shingle is okay and what shingle isn't. Do you find that confusion?
Well, the fact that I've been trained in spiritual healing and then the degrees in Oriental medicine, I mean, I think for Congress we need to look at our Doctor of Oriental Medicine degrees. Because that's really what they're going to respect, is our medical degrees. So that's how we're approaching Congress to recognize us as doctors of Oriental medicine, not medical doctors, and to grant us coverage, Medicare coverage from that.
And what are those degrees?
We, in the state of Florida, have a Doctor of Oriental Medicine and an acupuncture physician. Those are the two degrees that we hold.
Florida licenses those?
That's right. The state licenses, yes. There is a national licensing organization that I'm also licensed under. Some people just do their state, but I did both state and national. But our degree is, it's intense. It's 6 years of training. We have to have a bachelor's degree in Western sciences before well, sometimes we can do it at the same time, before we can get the Oriental medicine degree. So we actually know both. I mean, Western doctors only know Western medicine, but we have to be trained in both. So we have Western medicine training, and we also have, not surgeries, of course, but the anatomy, biology, chemistry, all that, physiology. And then we have the Oriental medicine. So, yeah, so it's a lot of studies. Yes.
Listening to you seem to be healing both psychically and spiritually. So if you get too involved with, say, materialism and the intellectual part of you, do you think some of your skills or whatever they're called will be diminished?
Yes.
You do?
A little bit. I mean, I know from my training with the blind acupuncturist that when I am as a person, when I am centered and when my mind is taking a back seat and I'm just present and energy's flowing through me through the needle, there's much greater healing than my intellect is at work. Does that answer your question? Okay. And they even showed us the differences. We would have a patient, and one of us would be feeling their pulses, and would be three of us, and then a practitioner with acupuncture would be treating them, and our teacher would say, okay, to the practitioner, think about, what you're going to make for breakfast tomorrow or something, and we would feel, when they're needling, we would feel the pulse, and it wouldn't shift very much, and then he would say, clear your mind, focus. They teach us these postures. It's almost like Tai Chi. We have postures where we know the flow is going through us the best, highest way. And then we would be feeling the pulse, and it would shift up to where it needed to be.
Well, the reason I asked that question, you mentioned that you're working with the etheric body. And that's really we all know that your natural body is just the mold of the etheric body. So you're already working on a high plane.
And I do work at the physical body too, when necessary. Mostly
you have to.
For pain, I'll put in some needles and leave the person there. I often leave needles in a few minutes, but the most important part is treating at the etheric body. Yes?
Isn't there a way osteopaths finally got the respect that they need in this country? Isn't there a way that you could combine your energies and your practices with the osteopath somehow?
There are two different trainings. I don't think so. I'm sure some osteopaths do acupuncture, but I think they're too separate for that right now.
It's become more like doctors, more accepted by the insurances.
Yes.
And I'm an insurance agent, and that's what I was thinking, maybe if there was some combination of your training and their training, maybe that would work and get through a lot easier.
The MDs can have us under their practice, like their physician's assistants. I know some people who do that, and they can bill our services through insurance that way.
Oh, okay.
How do they bill it? In that case, how do they actually write as the service?
It's the coding. Knowing the right.
I know it's happening, but I don't know how to do it. Yes.
What about dental work?
Does acupuncture help with the pain or dental? Oh, well, the way that we're using acupuncture in dentistry is with anesthesia. and actually it's becoming a specialty in our field for acupuncturists to be working in dentist offices to use acupuncture for anesthesia instead of I guess the gas. I don't know, I want to share a quick story with you how acupuncture came to this country. Many of you may remember, I was way too young, no, I'm kidding. 1972, well, I wasn't that old. President Henry Kissinger, let me get this right. Henry Kissinger was the Secretary of State under President Nixon's presidency. And Henry Kissinger was making a trip to China in 1972 to make better relations with China. James Reston was a reporter for the New York Times, and he was traveling with Mr. Kissinger to cover his trip to China. While they were there, James Reston, the reporter for the New York Times, he had to have an emergency appendectomy. And they took him to a Chinese hospital, and they used acupuncture for anesthesia and post-surgery for his pain. So Mr. Reston did not get traditional anesthesia, he got acupuncture. So when they returned, James Reston wrote an article in the New York Times about this experience. And in this country, I mean, there were maybe a few Chinese doctors in Chinatowns around the country, but other than that, there were no acupuncturists in this country yet. So he wrote this article, and then my understanding is President Nixon spoke about it as well at some talk he was giving about how Mr. Reston was healed with acupuncture. And so from that point forward is how it started to flourish, and everybody was curious, well, what is this? So all of a sudden, later schools started to pop up. And today we have about 60 schools in the United States that train us. But that's how it really started. So
I know in New York where I lived, at that point, only physicians, MDs, could practice acupuncture for a number of years. Eventually,
yes. Yes. So it works really well for anesthesia. We don't have to get the gas, but you have to be trained in that as well. Yes?
How is acupressure and acupuncture related?
They're the same. What I showed you a few minutes ago with the wrist, that's acupressure. They both work well. I mean, acupressure works as well as acupuncture. So they're the same, except you're using your fingers versus a needle. But acupuncture is designed to treat the acupuncture points on the meridians. It's not just a massage. It's a medical treatment. Yes?
And how does reflexology fit?
Reflexology?
Yes.
No relation. That's massage. Yeah, the bottom of the feet has one meridian. Now every part of the body is a hologram. So every part of our body, I don't know if you've heard, we use the ears in Chinese medicine. Every organ is reflected in the ear. Every organ is reflected in the bottom of the feet. Every organ is reflected in the palm and the back of the hand. It's amazing, you know, every part of our body, we can take any part of it. The face, we can treat every organ in the face. The eyes reflect, we don't treat the eyes, but our bodies are these fascinating, intelligent, that we can treat anything with any part of the body. And with pain, most often I don't treat the area where you have pain. I treat a different part of the area that reflects that area. It's like a mirror image almost. So it's fascinating. Fascinating. Still to me to this day, it's just so.
Wonderful.
Yeah.
Wonderful.
Thank you. Thank you. How are we on time? Are we good? Shall we do the salsa? Something?
Yeah. Or music on track.
Okay.
Do you use music? No.
I have
Now that you brought it up,
a
yeah.
chant in my office that was, we kind of researched it, it settles people down, so it's kind of a chanting music. Yes?
Acupuncture did not treat or cure Alzheimer's or dementia?
No. No, cannot. I wish it could.
Well, I heard just recently, in fact, I think it was on yesterday's news, that Alzheimer's now has been identified, in fact, it was this morning, identified as some kinds of Alzheimer's, I wouldn't qualify that, as a result of some diabetes. So
Well, there's many theories.
Some are Trump, some are
But
CNN.
I do want to speak to that though. As I mentioned before, we've been trained to know, to predict things that may be coming, and we can tell when the meridians that run through the brain are getting weak, like somebody in their 50s or 40s, and we treat them. And I believe that we can prevent it, but we cannot cure it. No. That's one of the few things that we can't help. Most Alzheimer's, Parkinson's, and ALS, the Lou Gehrig's disease, we cannot help. It's just too ingrained. We can help the symptoms. Like I had a Parkinson's patient who, she had what's called cervical dystonia. Whenever Parkinson's, their muscles get rigid, and so her neck was like this for a few years. When she brought her husband, who was an MD, actually brought her to see me, and 6 months later, after I treated her, her neck was about, we measured it, it was about 60% up, about there. And that is a huge difference because she couldn't read before when her neck was like this. It's hard to read. She played the piano a little bit, so we couldn't help the Parkinson's itself, but we can help some of the symptoms of it.
What about lymphedema?
Lymphedema, yeah.
People with lymphedema.
Yes,
That does help.
we can help that, yes.
Because of the way some people think, the thought.
Yes.
Do you think that they are responsible for what I'm saying, that they brought it on themselves? What do you think?
I do believe, yes, our lifestyle, yes, does contribute, absolutely.
Because we really want to create.
I guess we all have our journeys here in this incarnation, and I guess it seems to be from the moment we're born until, but absolutely our thinking process, our beliefs contributes to everything that we manifest. Yeah. Yes.
I think there are about 3 or 4 Reiki masters in the room.
Okay.
What is your feeling about Reiki?
I love Reiki. I've been trained in Reiki also.
Oh, okay.
I love it. It's it's wonderful, and I use it sometimes in my practice too. Just being the presence, being the flow. As I said before, it's that healing energy. That's what our ultimate goal. But with oriented medicine, it's more working with these organ systems as opposed to just putting hands on a certain area. It has a theory, I guess, of the 5 elements. That was one thing I didn't mention. Our theory is based on, at least, there's 2 different styles of acupuncture. The Japanese that I mentioned is based on, our theory is the 5 elements or 5 phases, and they're fire, earth, metal, water, and wood. And just like in nature, if there's too much fire or too much water or too much air, wood, nature gets out of balance if there's too much of those elements. Same thing with our bodies. So our theory of how we select the acupuncture points is based on this theory of nature. And so that's how it's different than Reiki in terms of mostly in terms of its theory, but still the energy exchange is very similar. So it's quite fascinating. Yes.
I have a friend with cervical dystonia.
You do? Oh, you have a friend with one? Yes.
And she lives in the Fort Myers area, and she has to go all over Tampa to a neurologist. He's about the only one on the southwest coast. give them the injections.
She should try acupuncture.
I'm gonna tell her.
Because I'm telling you, right, this patient went from, just her neck to like this?
Yes.
Yeah, it went
Always
from
painful.
here to about there.
I'm gonna tell her that because in between those shots, she is in such agony.
Yes, and it relieved her pain too. But it takes 6 months or more.
Yeah, I'll tell her that. Maybe she can get away from the Botox.
Yes, because that's not treating the cause of it.
Right.
Yeah. Yeah, so. Okay.
Well, do you have cards that you could pass out?
I am. I have some.